Dr. David Kulla here we have Dee here, and Dee had, when she was younger, she tore her ACL, skiing accident, right?
Yeah.
Yeah, so ACL, a lot of you that have played football or any sport where you have to change direction quickly, ACL injuries are pretty common. Same thing with skiing. So she was real young when she had her ACL repaired, and what they do is they take a tissue graft from your another part of your body, and it's more common to have it done from the hamstring, and that's where she had it done. But they also take it from the patellar tendon. But now she has complained of, it was not just pain in your hamstring, right, but sort of cramping.
Yeah, it's more of like it's not super painful, but like a bit of a cramp, yeah.
Yeah, so when she would stretch her quad, I think it was, not even the hamstring, she would get like a Charlie horse, sort of.
A little bit, yeah.
A little bit of a Charlie horse in that hamstring. So when they take, tissue from the hamstring, there's scar tissue that builds up there. So what we're doing is we're using cold laser therapy to break up the scar tissue in the hamstring. We don't know exactly where because we can't even see the scar. She was so young when she had the surgery. But we're pretty much doing the whole hamstring here. Yesterday, in the past few treatments, we've scanned her hamstring to find those areas. So this laser here scans soft tissue, and it tells us any areas of soft tissue inflammation or damage. And I've done that, so I know where all the spots are where she has damage and inflammation. So we're lasering those spots and breaking up the scar tissue and healing and repairing the tissue. Scar tissue heals like this, crosshatch, like that, right? You want all the tissue in one direction so you can increase your flexibility, range of motion, not have Charlie horses and things like that. So after 10 to 15 laser sessions, this should be completely healed or close to completely healed, and she shouldn't have any of those problems anymore. I don't know if you've tested it. Have you tested it in the last day or two?
Not yet.
Okay. Yeah, we're in the beginning of our treatment here. I think we're on laser treatment number 4, maybe?
Yeah, sounds right.
Yeah. So we use different frequencies to break up scar tissue. It's important that the practitioner that's using the laser knows what they're doing. The first few treatments, we used 1,000 hertz. Now we're down to about 50. And that's going to increase blood flow and promote soft tissue healing and repairing. And that's what we want to focus on with her. So luckily, she's not having really any knee pain at all, which is great. But she had an ACL repair, and the range of motion probably isn't quite the same as the other one.
Yeah, a little bit.
So it's the range of motion isn't quite the same. So what we're doing here is just touching it up with some laser therapy on her ACL repair, which is this knee, this left knee. And again, she does not have knee pain, but because there is scar tissue and there's a little bit of a reduced range of motion, we're going to go ahead and break up that scar tissue in the knee as well, where the surgery was. We're going to go from different angles into the knee, the front, the back, the sides of the knee. And today we're also going to fit her for orthotics, because the gait is everything, especially when you're dealing with knee problems, foot or ankle issues, plantar fasciitis. So I see here you brought your orthotics in and your inserts in. This is just one pair of shoes it doesn't fit in?
Well, it's like the most common pair of shoes I wear.
Okay.
And I compared the insoles, and most of them are about that size. Like, they're not bigger than that.
Okay.
Yeah.
So we're going to trim her orthotics. They're a little bit longer than her insoles that go in her shoes. So these are easily customizable, these orthotics. We can trim them down so make sure she has a perfect fit in her shoes. And you see here I'm going from behind the knee, even though it's the ACL, which stands for the anterior cruciate ligament. I know that it's in the front. This laser penetrates several centimeters deep. So we want to get through the joint in all different angles. And that's what I'm trying to do here. And I'm going to have you flip over on your back in just a minute here, okay? And when it comes to tissue repairing and healing, nothing comes close to cold laser therapy. And I'm speaking, from experience. I've torn my Achilles. I have two partial tears in my Achilles, and it would have been really hard for me to get back 7 months later and do another triathlon. I was able to do that because of cold laser therapy. So, as far as tissue repair and healing, nothing even comes close. Okay. So, in a second here, we'll have you turn over and do the front of your knee. Okay, turn over on your back. Okay, any foot pain on the bottom of the feet?
No.
Okay.
I've been doing the 3 hour. I haven't gone up from that because at about 3 hours it felt like enough.
You mean breaking in the orthotics?
Yeah.
Okay. Okay.
But I'll continue to
So
do
they
that.
fit in those shoes.
Yeah, because those are like those shoes are big, so they like fit.
Okay.
Yeah.
Are those the only ones that they fit in?
Yeah.
Okay, so these are the only shoes they fit in. These are what you've been wearing for the last few days to break them in.
Yeah.
So we're gonna trim them down. They may be a little loose in those shoes.
That's okay.
But I'm gonna try to diminish that. Those orthotic, those inserts there that you brought me, are those the biggest of the ones that they don't fit in, or are they all right exactly spot on?
I think that's a good middle ground.
Okay.
The shoes I'm wearing are the biggest ones that I wear, and those are probably right in the middle.
Okay. All right, because the reason I asked that is we don't want to cut the orthotic too short because you can't put back on, right?
Right, yeah.
So we can always trim a little more if we need to,
Most of my shoes are not bigger than that.
Okay.
Yeah. The running shoes are just acceptable.
So I'm gonna outline those inserts,
Okay.
the back of the orthotic, and then I'm gonna give it another millimeter more.
Okay.
And then that way, try them, and if they're still curling up in all your other shoes, then we just cut off that little 1 millimeter sliver on the end of the orthotic, okay? So, folks, this is pretty straightforward. The laser does not hurt, right? You don't feel anything when this is being done. And they have so many different applications and what lasers can do, but this is certainly a game changer. If you're thinking about getting ACL surgery or a PCL surgery, you can definitely do laser therapy before you get the surgery. In fact, I recommend that you do that because there have been cases of ACLs tearing and repairing in 3 to 6 months on their own. I bet you didn't know that. So there are a lot of cases of this, and sports chiropractors are leading the way in that, and Dr. Kevin Heron specifically. So he has a whole protocol for that, where you can tear that ACL and regrow it again and repair it again without surgery. So there's been some advances in that respect. But if you're considering ACL surgery, you haven't had it yet, try laser for 2 to 3 weeks, a couple times a week though, not just once a week, and go from there. And then if you need the surgery after, you can always do the surgery and then do the laser again after the surgery. And you're going to heal much faster, and you're going to get through that post-surgical pain much, much faster. Okay, now we're going to adjust her, but she would like to be adjusted in private. So folks, thanks for tuning in. If you guys have any questions about ACL repairs, cold laser therapy, and how it applies to ACL and PCL repairs, comment below. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.